main benefits of knee replacement surgery are four. Pain relief, better mobility, and response for the future treatment, and good success rate after surgery. It means about 80 to 95% of the patients are satisfied with the surgery after 1 year or even after 15 or 20 years. There are many types of knee prosthesis. It depends what kind of deformation you have, which part of your knees is damaged. If the damage is only in one compartment, for example, in middle side of your knee, partial knee prosthesis can be used. Partial knee prosthesis is much smaller than total knee. This is total knee, this is partial knee, with the same three parts, but these are much smaller. So this can be decided during patient's evaluation and discussion with the patient, and the surgeon can decide which type of prosthesis can be used. These small prostheses, like partial knees, have a lot of benefits. It's a preservation of bones and other tissues which are healthy, small incision, less blood loss, faster rehabilitation, better function, better mobility. Even this revision prosthesis can be used if there are some bony defects and some ligament dysfunction. So it can be used even such a big prosthesis like this.